morning, everyone. Thank you so much, Megan, for setting the stage with Access. Welcome, everyone, to the Disability Organizing Network's part one of a two-part series on advocacy and lobbying. Today is the national perspective. I'm so excited for what the next hour and a half has in store for us, both hearing from our presenters as well as what all of you will have to offer via Q&A. So just in brief, I wanted to share a little bit about the Disability Organizing Network. Again, my name is Allie Cannington, and I'm the statewide community organizer. The Disability Organizing Network is a program of the California Foundation for Independent Living Centers, and the Disability Organizing Network is funded by the State Independent Living Council in California and administered by the Department of Rehabilitation. It is one of the greatest gifts of our work in independent living and disability rights, but specifically independent living, to be required to do systems change advocacy. The changing of systems so that there is greater access, freedom, justice, and independence for people with disabilities. Specifically with the Disability Organizing Network, we inform, mobilize, and organize people with disabilities across California to create more just and equitable systems for people with disabilities. We believe that long-term systems change can only be possible by organizing our community, but all of this falls under the umbrella of systems change advocacy. And too often the lines get blurred on what is advocacy, which is what organizations that have federal funding can do. Specifically, we're going to be talking about independent living centers today. And then also, what is the difference between advocacy and lobbying? Lobbying, which we are not allowed to do with federal funds. So today, again, will be part one of a two-part series to break down the differences between lobbying and advocacy from a federal perspective today. And then part two will focus on California specifically. And so I'm proud to introduce our presenters for the day. So first we have Kimberly, and I may get your last name wrong, but Tussaud? Yeah, I got it. Okay. She serves as the executive director of ABLE South Carolina, which serves half of the state. She and ABLE South Carolina is a Center for Independent Living or Independent Living Center. She currently serves as the co-chair of the National Council on Independent Living's ADA and Civil Rights Subcommittee, as well as the National Council on Independent Living, or NICL's Parenting Task Force, as well as many statewide boards and councils. So welcome, Kimberly. Thank you so much. And we also have Steve Higgins, is the Executive Director of Independence Associates, Inc., located in East Bridgewater, Massachusetts. He currently serves as the National Council on Independent Living's board as the representative for Region 1, as well as the co-chair of the ADA Civil Rights Subcommittee. Additionally, Steve has served several terms as a member of the Massachusetts State Independent Living Council, or the SILC. So I'm going to let you all take it from here, but I am really looking forward to continuing to do what I can to moderate today with Megan, and I'll let y'all take it away. Thank you.
Nice. All right, why don't I grab the first few slides and we'll go through that. We're really excited to be here today. This presentation actually, Kimberly and I developed this with a bunch of our friends, basically the ADA and Civil Rights Committee at NICL. And we started talking about this last year, long before we all started to get that letter from the Administration for Community Living, and just getting back to the basics of who we are as a movement. And so our first slide that we have today really talks about advocacy and that it's required. The Centers for Independent Living program provides 354 discretionary grants to CILs, which are consumer-controlled, community-based, cross-disability, non-residential, private, not-for-profit agencies that provide AL services. At a minimum, centers funded by the program are required to provide the following core services. Now, this probably doesn't sound like anything new to most of you that are on the call and on the video today, but one of the things that we felt very strongly about is how does ACL define these things? And when we were developing this entire presentation, prior to the nickel conference and even refining it for today. And I know Kimberly's done it elsewhere. I'll be doing it later this week in Massachusetts. It's important to know exactly what ACL is defining things as. So information and referral, skills training, peer counseling, individual and system advocacy, and services that facilitate transition from nursing homes and other institutions to the community, provide assistance to those at risk entering institutions, and facilitate transitions from youth to post-secondary life. So advocacy is not just a reaction. When we started talking about that, we started to see these things coming out, and what we were hearing from many advocates in the community is that advocacy is only done in a reactionary way, or some folks got letters from ACL and there was this fear, can we even do advocacy anymore? So let's just get into a couple of quick slides here on advocacy, and then a little bit of what ACL defines. And then I'm going to turn it over to Kimberly, probably like 6 or 8 slides down here, to jump into some of the detailed stuff. So advocacy, it's at the core of our independent living and disability rights movement. In fact, our movement would not exist if our voices were never heard. It's just the core of who we are. Yet as we have grown here, we see changes in staff, community leadership, and laws, and many people are being told that we cannot advocate, or let alone even mention, as we put it in parents here, the A word. And what we want to share with you today is that's not the case at all, because advocacy is really the heart and it's the key to who we are. And individual and systems advocacy is something that is still truly clearly defined by the Administration for Community Living. So ACL, this is ACL's definition of advocacy. So this isn't Steve and Kimberly's, something that we just kind of pulled out of a rabbit hat here or something. But it very clearly states that in the context of ACL, independent living programs are supported through funding authorized by the Rehabilitation Act of 1973 as amended. The Act. Title VII, Chapter 1 of the Act states, the current purpose of the program is to promote a peer philosophy of independent living, including a philosophy of consumer control, peer support, self-help, self-determination, equal access, and then we've got in big letters here, and individual and systems advocacy, because ACL clearly says this. So in order to maximize the leadership, empowerment, independence, and productivity of individuals with disabilities, and the integration and the full inclusion of individuals with disabilities into the mainstream of American society. So just, this is, as I said, this is ACL's words. This isn't anything that we made up. So when earlier this year, when a lot of folks, in fact, all of us received these, notifications around advocacy and what we could and couldn't do, it really confused a lot of folks. And so we felt it was very, very important to, let's go back to what does ACL really say? And so this is, if you jump on ACL's website, look at any of their materials, this is what ACL is defining advocacy as. So advocacy as a whole, when we look at it, it's really just peer for who it's part of exactly who we are as centers. Advocacy is an act or a process of supporting a cause or an issue. So it's an act or a process of supporting a cause or an issue. As persons with disabilities, we do individual advocacy. We work on systems advocacy. And advocacy is just that. It's the act or the process of supporting a cause or an issue. Advocacy addresses inequality. If we weren't out there advocating for the inequalities that we all face in society right now, we'd still have barriers that, out there, like there still wouldn't be access to things like curb cuts and basic things like that. And advocacy lets our voices be heard. Others shouldn't be speaking for us. Individual and system change advocacy are different though. So advocacy really, it's the process as a whole. It's taking everything and putting it into context so that we have an understanding of what is it, what's important to us, what are we educating our community about, how are we going to address the inequalities that we face in society today, And how can we still do this in a way to allow our voices to be heard so that others are not speaking, not necessarily even for us, but about us. And that's one of the biggest challenges that we still face. You know, as the disability community, we need to be able to share who we are. Okay, so we've got a couple pieces here that are really nice pieces, and the folks that actually contributed this are Kathy Hull and Brad Mearns, who are out in Nebraska. And some of you have, over the years, have heard their names. Kathy does a lot with voting rights at Nickel. And so they broke it down into its most simplistic form. And what is it? Well, the what is it in advocacy is it's an act of supporting a cause or an issue. Any action that speaks in favor of or argues of a cause or need for change. So it's really simple when we think about that. Really, it's just what is it that's important to us? Why is it important to us? So that's the next thing, it's the why. The why is really, it's truly the only way to make changes in your community and in your life. If we as persons with disabilities aren't speaking out, we're, you know, a lot of people just say that we're invisible, that people don't see us or they don't hear us. And so it's powerful that we speak out as a community. And this is something that, you know, it's the important as far as the why goes. So the who can do it? Anybody. There's no required credentials. You know, you don't have to be listed as some sort of an expert because you're already the expert about living with a disability. You know, the most important thing is it's important to tell your story. Nobody can tell your story about who you are better than you. You know, our senators and our legislators, they want to hear personal stories and facts from the people on the ground. They want to have an understanding of what's important to their constituents, and who best to tell them what's important to their constituents than their constituents themselves. Sharing our own personal stories in a way that only we can. Nobody can share the experiences that we've all had with disability. Nobody else can share the discrimination levels that we've all felt ourselves based on our own disability and the things that we've witnessed. So we really truly are the best to tell our story. The key to understand is that you don't have to have all the answers. Solutions are designed over time in many discussions with multiple players, which is why we cannot do advocacy alone. Community organizing is essential to systems change. Working together is the local independent living center, working together with other organizations in the community. It's so powerful to be working together in partnership with others as they have an understanding of what true advocacy is and what we really can do. So where can it be done? We put as a committee anywhere and everywhere. The legislature, the town or city council meeting, the school, the doctor's office, social media, and anywhere. You see, advocacy starts on the local level. A lot of times we think first that advocacy is something that we're only doing when we get to the State House, or we're only going to advocate at our town hall or our city hall. But advocacy really starts in other hallways. It starts in our local schools as we advocate for access to education. It starts in our doctor's offices as we talk about things like having accessible exam tables. You know, here in Massachusetts, it's really interesting because a lot of people say that, you know, I live just south of Boston. A lot of people say that we have one of the best healthcare systems in the United States of America. How scary is it that in our entire state, there's only about 10 accessible mammography machines? That's really scary when you think about that. So as we talk about access to healthcare or about the experience that we all have as persons with disabilities, when we go to the doctor's office and they've got somebody in the only accessible room with an adjustable table, and we have to wait an hour and a half for our appointment because things weren't thought out about the accessibility of the next person that might be coming in. So these are places that advocacy, when we talk about it from an educational standpoint, where it really starts and where it really makes sense. Social media is a great place for advocacy, but always be careful when you're utilizing social media. We need to make sure, you'll hear as we get into some of the other slides, and I know Kimberly is way more of a better expert on this as we get into some of these slides, really how we utilize social media and how we do things in a way that we're doing advocacy versus lobbying. So it really comes down to the anywhere and the anyone. When we're out in the streets, when we're out talking to people, that's when it should be done. You know, there's no time limits, there's no conditions. Any time change is needed, and it's important to consider timing of what you advocate based on important dates on the calendar, i.e. in your state, what's your legislative calendar? And even in your city, important holidays, it's always important to make sure that we're thinking of all the members of our community so that everyone has the opportunity to participate. And sometimes we forget that there's holidays and there's things like that that others celebrate. And it's really, really important that we make sure that we're inclusive of our entire community when we get out there and when we work together as a team to do the advocacy. But more than anything, it's understanding that there are no time limits or conditions, that advocacy can be done anytime, anywhere. And that's really something that's very, very powerful. So how is it done? It's done through education. It's done through developing information and communicating that information through many, many different forms. It can be through the spoken word. It can be written. It can be in person. It can be digital. And one of the places that many people forget is in the arts. You know, we have commonalities, and there's one thing that we will find that when we talk out there, everybody likes some kind of art and everybody likes some kind of music. And those are powerful forms and powerful ways to talk about advocacy and to share what's important to us. Because even with our expertise and our own individual experience, effective systems change advocacy needs to include relationship building and our own background research on the issues or causes at hand. You know, relationship building is one of the most powerful things in advocacy. It's one of the most powerful things that we can all do, and that is building strong relationships in our community. That relationship building is not just relationship in our independent living centers, in our silks, in our state organizations, but also throughout the entire community with other organizations that every single one of us interact with. LGBTQIA organizations, as we talk about intersectionality, others that we talk about, parents organizations that are working with with our young kids in school. There's so many places that we can work together and develop relationships. We have a small group in our area, and it's parents that they recognized that there were like 5 families all of a sudden with young children that had Down syndrome in a local school, and they didn't know how to get together. So it was an opportunity to start to bring parents together to see that we're not in this alone, and we're working together towards a cause. So I'm going to turn it over to Kimberly for the next slide.
Hey everyone, this is Kimberly and I'm here today and I am really excited. I don't know, this has become my favorite topic to present about because I truly believe that we do need to do both advocacy and lobbying. But I want to reassure you that they are very different, and that today I'm going to show you how you'll be able to do both. So what is the difference between advocacy and lobbying? First, we're going to cover lobbying. So CILs cannot lobby with subchapter B and C or any federal funding. So with any type of federal grant, you're always going to send, and even state grants, you're always going to sign something that you are not going to be using the funding to lobby. And this is not new. This is something that we have been doing for years and years and years. So when the ACL FAQ came out a couple of months ago, it should not have been that surprising to people that we cannot lobby. CILs and nonprofits can lobby with unrestricted non-federal funding. So that's funding that you may get for fundraising, fee-for-service income, that type of activities where you want to build your reserve, your unrestricted funding, so that you could set aside some of that for lobbying activities. During the next couple of slides, we're going to talk about how to document your lobbying activities and how you, and kind of what, again, it means. But I will give you a little bit of a hint to what we do at our organization, and we do lobby and we do systems advocacy, but we treat lobbying as a completely separate program. So it has a separate funding source, which is unrestricted funding set aside. I budget for lobbying a year, and it's documented on every single thing we do when we lobby. So I will get to kind of the admin pieces of lobbying shortly. So these are the definitions of the lobbying and advocacy and what both mean. And just for accessibility purposes, I am going to read the slides. So lobbying is an act of engaging with local, state, or federal government officials and government agencies, elected officials, their staff, and other government employees with the intent to influence. So remember that word, to influence, or it can also be your ask for funding, support for, or opposition to a particular issue or piece of legislation or potential appointment. Advocacy is the act of engaging with government officials and agencies, including elected officials, their staff, and other government employees, to educate and provide technical, factual, and nonpartisan information about relevant issues. So quickly, what you can remember is lobbying is your ask to influence, your ask. So you are asking something when you lobby. Advocacy is when you are educating, when you're providing an education. So for example, you're providing education on how the disability community may be impacted by a particular piece of legislation. And then there's direct and grassroots lobbying. So direct lobbying is an attempt to directly influence or any actions by federal, state, or local legislative or executive branches. Lobbying government officials, as in the example above, is considered direct lobbying. So when you're directly asking a legislator or their staff for something, that is direct lobbying. Now, grassroots lobbying, and I did see a question come up earlier about grassroots lobbying, is indirect lobbying, and it includes efforts that encourage members of the public to contact their local, state, or federal elected officials, urging their support or opposition of a specific issue or a piece of legislation. So in effect, grassroots lobbying involves a federal grantee encouraging stakeholders to lobby. So that is also unallowable. So both direct lobbying and grassroots lobbying is unallowable with federal funding, including Part C and Part B. So that grassroots lobbying, kind of going back, is kind of encouraging, and I think I see a lot of action alerts from centers and different organizations. I hope they're using unrestricted funding for that, but it is that particular engaging your consumer base to act on a particular policy, and you're kind of giving them a position up front to act on. And so I'm going to give you a little bit of an example of how you can do action alerts without encouraging your consumers to go one way or the other. So I'll give you an example in a little bit. So every year, and I think we all just signed this, all the executive directors, you do a certification regarding lobbying, and you have to sign a form every year before they'll give you your award for Part C and Part B that makes the promise that you are not going to use your federal funding for particular lobbying activities. And so we sign off that we are not going to improperly influence activities regarding obtaining grants, contracts, cooperative agreements, or loans. So we're not going So that this also means going to our state house and asking for state appropriations for Centers for Independent Living. So we can't do that with federal funding. Attempting to improperly influence employee or officer of the government, or attempting to influence outcomes of federal, state, or local elections through in-kind or cash contributions, endorsements, or publicity. You are also not contributing to the expenses of a political party, campaign, or political action committee, or you're attempting to influence votes for or against specific legislation. And I know that one is probably closer to all of us than any other part of lobbying activities. So we'll go over how you can do that without direct lobbying. And then again, all Part B and Part Cs are required to sign this annually. So we've been signing this for years and years, and it's been saying that we're not doing these activities. So, and then this is the OMB Circular 2 CFR Part 230. And this also explains what is not allowable with federal money. And so again, it really breaks up that any attempts to influence the outcomes of any federal, state, or local election, referendum, initiative, or similar procedure through any in-kind cash or contributions, endorsements, publicity, or similar activity. We cannot establish, administer, contribute, or pay the expenses of a political party, campaign, political action committee, or in other organizations established for the purpose of influence the outcomes of elections. So sometimes, as much as we like that person who's running for governor, we cannot endorse him with federal fundings, him or her, or they. We cannot endorse them with federal funding. And then any attempts to influence the introduction of federal or state legislation, the enactment or modification of any pending federal or state legislation through communication with any member or employee of Congress or state legislator, including efforts to influence state or local, so this is local as well, which means your city council, all your mayors, to engage in similar lobbying activities, or with government officials or employees in connection with a decision to sign or veto enrolled legislation. And then also just more unallowable, and then I'm going to get to the allowables, I promise you guys. Any attempts to influence the introduction of federal or state legislation, the enactment or modification of any pending federal or state legislation by preparing, distributing, or using publicity or propaganda, or by urging members of the general public or any segment thereof to contribute to or participate in any mass demonstration, march, rally, fundraising drive, lobbying campaign, or letter writing or telephone campaign, or legislative activities, including attendance at legislative sessions or committee hearings, gathering information regarding legislation, and analyzing the effects of legislations when such activities are carried on in support or in knowing preparations for an effort to engage in unallowable lobbying. So this is really when we are influencing bills, when we're going and testifying for or against a piece of legislation, when we're doing grassroots lobbying, when we're asking our consumers, our members, to go and ask a representative to vote one way or the other against or for legislation. So now we will go into questions and answers before we go to the next part.
Great, thank you, Kimberly and Steve. So we have a question that actually just came in, I believe, about your last slide, Kimberly, from Benjamin, and he wants to know, does this also apply to local legislators? For example, a board of supervisors?
It does. It does. So we cannot do local, we cannot do any lobbying activities with local, state, or federal folks.
We have a question here from Charles, and I believe you did cover this, but it says advocacy can be encouraged. Can advocacy be encouraging others to write letters of support to the state or Congress?
So yes, so that could be, that's grassroots lobbying, when you ask for letters of support for a particular piece of legislation, if that's the question. So that would be grassroots lobbying. And I'm going to talk with you a little bit about this, but what you could do is you could ask your consumers to share how a particular bill would impact them, and they could share their story, and that would make that education. So they would educate the legislators about how a particular bill would influence the disability community.
Good. I hope that answered your question, Charles. If not, let us know. And then we have a statement or question here from Maria. Okay. So Maria wants to know, it would be wonderful, if possible, to simplify the really long bullet points to a more concise, simple answer. Is that something we can have?
And Maria, what I'll do is, I am not an attorney, and so therefore, and I'm in South Carolina, and I'm just used to not interpreting any kind of laws for anyone, because I could actually be prosecuted for that in our state. So what I've done is also just listed the exact language that is in the OMB circular. But what I'll do is I'll try to go through each of those a little bit better to try to give examples of what each of those means.
And then Ron says, it sounds like grassroots lobbying also includes signing your center to support or oppose letters. How do we get around that?
So again, you're exactly right. So that is grassroots lobbying, when you ask somebody to sign or oppose or support any type of legislation. So what you would do to get around that, and that's exactly what, hey, we do this every day. We do both. But we sometimes will use our lobbying funding to do that, which is our unrestricted funding, to ask for them to support a particular legislation, especially if we wrote it. But what I would recommend is for people to actually have their consumers, again, how can we educate? You can write a letter to the legislators and tell them how a particular bill would impact the disability community without asking them to vote one way or the other. So you can educate them on how a piece of legislation can impact us versus asking them to not vote for something because of X, Y, and Z.
Right, and we do that the same here at our center. And one of the things that we've started doing, especially with some of our young folks in our youth program, is really sitting down and working with them on how to write the letter, how to do this in an appropriate way. And it's really become powerful, because at the same time, not only are you teaching someone how to be a self-advocate, but you're empowering young folks to really become part of our community and have a full understanding of everything that we do.
Perfect. And it looks like we have a follow-up here from Charles. So he says, if I provide education on a bill or other legislation, can I ask or recommend that individuals share their stories with appropriate officials?
Yes.
Is it okay to give them the addresses to write to?
Absolutely. So you're assisting them with self-advocacy, what Steve said too. You're assisting them with educating a legislator on how that bill would impact them. Now, what would become lobbying is if your SIL, your LLC, would ask your consumers to tell the legislators to vote no on a particular bill or to vote yes. That would then be lobbying. So remember, asking, so you don't want to ask your consumers, you don't want to ask your legislators to vote one way, but you want to educate. That's the key, is to educate.
Perfect. So much good information today. We have a question here from Dolores. She wants to know, can an ILC staff member attend a local political candidate's event outside of working hours on their own time as a private citizen? Will that have any implicit conflict of interest?
Dolores, you may want to check with your executive director, but I'll tell you what we do at our center. Our staff can absolutely go do this on their own time, just as long as they're not talking about our organization. And as long as they're not wearing like an ABLE South Carolina name tag or T-shirt, but they are more than welcome to go as a private citizens to go use their voice and to go support a candidate.
Well, and that also goes back to that famous piece that Justin Dart taught us all about getting involved in politics as if our life depends on it. You know, our local legislators and folks that are out there, you know, when we go home from work, you know, our local legislators are folks that are running campaigns. And it's powerful for a person with a disability to participate in that campaign, because you're sharing so much stuff about the disability community just by being you and just by being there and being part of that. So after hours, whether it's holding a sign on a corner, as long as it doesn't have Independence Associates like my shirt on it or something like that, that's really okay, because that's really us as persons exercising our own rights, and it just speaks highly of who we are.
Thank you, guys. And we have a question here from Maria, and she says, could we create a simple template letter and inform the consumer how the issue is affecting the community and provide an ask to sign a letter that is in favor or against the issue or bill?
So that would be grassroots lobbying.
Right.
You did that. And so that would not be allowable, because you're asking them to support or vote against a piece of legislation. So what you could do in that situation is you could do an action, like you could do a action alert type of activity, like type of email blast. And what you would want to do is you would want to, talk about the issues that the bill could present to the disability community. And you could support them with writing, you could support them with contacting the legislator by providing their information, but you would not want to ask them to support one way or the other. So they would make that decision for themselves, whether they support or oppose that piece of legislation.
One of the challenges sometimes too in that is just having the understand of not having to ask. You know, that's the key piece. Is you write your template and write your letter. It's developing a good template and letter that does the education piece of it and making sure that the ask piece isn't there, because the second that we put the ask piece there, that it turns to that lobbying, whether it's grassroots lobbying or systems lobbying at your center, that's when it turns to lobbying. You have to think of when you put the ask in is where that happens.
Okay, so we have a few follow-up questions here. Ron wants to know, just to be clear, we cannot wear our center shirt while doing a legislative visit or attending a town hall. Is that what you're saying is lobbying?
No, you can wear your shirt. I wear mine at the State House all the time here in Massachusetts, and when I'm out at the town hall. It's just whether or not you're doing an ask or whether or not you're educating. If you're doing an ask, then you're lobbying. If you're educating and when you're teaching about what's important in sharing your story, you're advocating. You're not asking a legislator to vote in a particular way, or you're not asking an influencer, so to say yes or no to something. So you can clearly, be proud of who you are and where you work, and don't be afraid to show up at the State House, as a team together, and to do that. But when it becomes lobbying, always remember, is when you do the ask. So make sure that you're not doing the ask wearing your shirt.
So, or when you're supporting a candidate, so or supporting a particular political party as well. So, so that's when you've got to be careful. Like when you're going maybe for a rally to go support a candidate, that's where you want to be careful with your shirt. But I mean, go to your State House and proudly wear your shirt to educate lawmakers about what your center does, and or what some of the barriers are that are impacting citizens with disabilities in your state. You can educate all day long in your shirt.
Nice.
Thank you, guys. And it looks like we have one last follow-up here from Charles. So it looks like he's asking, would creating a template for the individual to share their experience be included as advocating?
Absolutely. I think that is educating. So you're encouraging self-advocacy during that moment. You're encouraging people to use their voice. You're encouraging them to educate. Because again, if lawmakers do not hear from us, they're not going to know how the negative and positive impacts of particular pieces of legislation. So absolutely, like that is absolutely fine. And I'll show you in a little bit kind of how we've done an action alert like that as well.
And sharing your personal story, we talked about that, and we're even going to allude to that, you know, a little later in the presentation, is so powerful because it's your personal story. And, you know, when you're sitting down and talking to your legislator and you're talking to the, you know, whether it's a member of Congress, whether it's the state legislature, whether it's your mayor or school committee or others, you're sharing your personal story in a way that no one else can share it other than you. And that's the power of that. And that's, many legislators will tell you that they've made a decision on how they were going to vote based on somebody's personal story.
And just following up on that, Pilar wants to confirm, telling a story is counted as advocating or educating, correct?
Yes,
Yes.
that is correct. That's not lobbying.
Perfect. And then Richard says, is it okay to lobby on a personal issue outside of the Independent Living Center, or am I never able to lobby because of my job?
You can lobby outside of your position. So you can absolutely, might want to check with your state laws though, because there are some states that if you talk with a legislator, you have to be a registered lobbyist. So making sure you check with them first. And then also, you know, if your center does lobby as well, you know, I want to be very mindful to say this, that centers can do both. They just can't lobby with federal money. So if you're using Part C or Part B or any type of other federal grant, you cannot use that money to lobby. But if you do have unrestricted money from fundraising or whatever, you can lobby. So our Center for Independent Living, and we've had an ACL comp review and all that stuff, and so they've seen our activities for lobbying, and we were given a thumbs up for it. But we lobby with unrestricted funding, and I'll tell you, it's very little money. We do have a private contractor that we use. And so we spent last year, I believe, about $24,000 on lobbying, and we wrote and passed legislation. And so that is, you know, that is something that you can do, but just remember, not with federal money and not without, you want to definitely make sure that your ED is involved before, if you have questions about any type of lobbying activities as well. Right. So CSIL's lobbying, they must be using unrestricted funding.
And that's really the key, the unrestricted. That word unrestricted is so powerful because even sometimes we all get, you know, many of us get grants from our state, sometimes from our county and other places. And those are also places that you should not be utilizing those dollars. It needs to be unrestricted dollars that you're using in your lobbying. So we're not just talking federal dollars here, understand. Because all of our state and county dollars many times also come with rules that are very similar. And so we need to make sure that we're following the rules of how we receive those dollars. And when we are lobbying as a center, making sure that we're clearly documenting and clearly using our unrestricted funds to be able to do that. Because nowhere does it say that we can't lobby. As long as we're using unrestricted funds, we can do that.
And I'll show you some examples in a little bit too of how we document our lobbying activities. So even if I call and make a phone call to one of our legislators, I document my time on my timesheet as lobbying, which is then connected to our unrestricted funding source. So I document every penny that I spend every day with all my funding sources that we use. But when I do lobbying, I'm extra careful with making sure that I have a note on my timesheet, that I have supporting documentation backing it up, so that if ACL does ever come and make a site visit, I will be able to very much clearly show them how we lobby and with unrestricted funding, and that we do not use any federal funding during our lobbying activities. Yeah, and I'll also be at the April conference presenting with ACL on this topic. Is it next month? It is next month. So I'll also be there for questions and answers as well, if any of you are planning on attending the April conference.
Thank you both so much. We're going to go ahead and take one last question before we move into the rest of the presentation. And Elizabeth Campbell has her hand raised. So go ahead and ask us your question, Elizabeth.
Hi, can you all hear me?
Yes.
Okay, perfect. This is a quick question about whether or not you're going to go into action alerts later in the presentation, because I have some conflicting information from a training that I received from Alliance for Justice and what constitutes lobbying or not lobbying in action alerts.
Yes, so I will actually give you an example of how we put out action alerts. And it wasn't about a particular legislation, but it was about an incident that happened with a person in our state, in our community. And so I'll show you an example of kind of our wording that we use. When there is particular legislation issues on a bill, our action alerts are just specifically education, and there is no action required necessarily unless the individual wants to educate their lawmaker about the impact of a particular legislation.
Great, thank you guys. We're going to go ahead and move on to the rest of our presentation. Please feel free to send more questions in the chat. We will hopefully have time at the end for some more Q&A time.
All right, Kimberly, you want to take it from here for a little while?
Yeah.
Nice.
So we are going to show some examples of what advocacy looks like and what lobbying looks like on a particular topic. And so Allie helped create these two. And so we'll start comparing kind of just so that we can all get a handle on exactly what this looks like a little bit. So here is an example of what advocacy looks like. So a nonpartisan fact-based presentation on research and data to federal representatives about the impact of money follows the person. And so this is just an example, and it's it just in a nonpartisan and fact-based way, the resources that were or were not available to people with disabilities. So if we go and we talk about how many individuals were able to transfer from a nursing home or a state institution into the community, and the better quality of life about the program, that would not be lobbying. When it would be lobbying is asking the representative to support or introduce a legislation or a support issue or allocate money, funding to a program such as Money Follows the Person. So what would cause that education to turn into lobbying is if I would say, well, this is the benefit of the program, and I'm asking you to please support Money Follows the Person. That would then cross that lines to lobbying. But if I go in there and educate about the benefits, maybe have people talk about their life living out of institutions, and educate them of how the quality of life, the state savings that Money Follows the Person provides, that is advocacy. So participation, so this is advocacy, what advocacy looks like: participation in a march, demonstration, or rally that will not endorse or condemn a particular piece of legislation or legislator. And so because the grantee may not be able to participate, whether the event will involve lobbying, grantees are strongly encouraged to review their annual notice of award and consult with their project officer before participating in any such activities. So don't really, if you have questions about your marching or have questions about any type of demonstration, you may want to check with your executive director and have them check with their grant, the project officer. But participating in like disability pride events, that is not lobbying. We're coming together as a community to promote disability pride and intersectionality within the whole entire community. We're trying to bridge that connection. So that is advocacy. Now, lobbying would look like participation in a march, demonstration, or rally that does endorse or condemn a particular piece of legislation and our legislator. So a great example of that, and we're going to talk about civil disobedience in a little bit, is the fight that it took to save our health care. They were 100% lobbying, but boy, did we need it, because they saved a lot of lives when we were able to save the Affordable Care Act. But that was lobbying. When you saw people getting arrested for protests and demonstrations and lock-ins, that is lobbying. So another example of advocacy is to inform the community of proposed changes that would impact them. Communication should be factual, technical, nonpartisan, and related to the specific topic. So a couple years ago, we passed something that's called Employment First for our state. And Employment First is the idea of that people with disabilities will given the right to be employed, and that state-supported programs will offer that as an option for employment. And so we gathered individuals up to share the barrier that it's taking them to become employed. And so that was something that they were able to educate the state. They did not say to vote for Employment First or vote against it. They really just kind of highlighted the barriers that are currently existing in the system that is preventing them from being employed. Lobbying would be to inform the community of proposed changes that would impact them and ask them to say yes or no to legislators or government agencies. And so that you see a lot of that in action alerts. So vote no, call your congressman to tell them to vote no. That is lobbying. So another example of advocacy is creating and sharing an online or in-person pledge petition that asks for people's commitment to specific issues such as disability vote, long-term support services, etc. So asking them to provide their examples of that. And it would not be for a particular piece of legislation, but it would be, pledge yes if voting rights is important to them. And then that information could be used to educate legislators. Lobbying looks like creating and sharing an online or in-person pledge that has specific ask of government officials or agencies. So that, I'm trying to think of an example of that. I guess there was Steve, there was a pledge against the ADA Reauthorization Act, right? So what was encouraged were people to sign on that would directly oppose a piece of legislation. And somebody could go and say, hey, we have 25,000 signatures of people opposing this particular legislation. But that would be lobbying, because what are we doing? We're asking people we're really influencing people to vote one way or the other, or to support an idea. Okay, so this is my example of an action alert. So a couple of months ago, well, in January, actually, our state, one of our state mental institutions, unfortunately, we still have them, and we are trying to advocate against them and for them to close. But one of our own people in our community were murdered in an institution by care staff. So we put out something that we called an action alert, and I don't think we necessarily called it an action alert in the email, but it was to share information or let's educate legislators, or something like that was in the wording. But the example is, and just for accessibility reasons, I'm going to read it. The top of it said, disability rights are human rights. And then it said, this weekend, the state reported that William Abbott, a man with psychiatric disabilities, was tragically suffocated to death by mental health staffers who restrained him. At Able, South Carolina, we are appalled to hear of his fatal mistreatment of an individual by professionals who are trusted to provide care. According to the state, a House Legislative Oversight Subcommittee has held 9 hearings to review the Department of Mental Health policies, operations, and budget, and have not once questioned the department about William's death. State agencies need to be held accountable through these oversight committees to prevent further tragedies like this one. If you want to speak up for William and people with disabilities across South Carolina, feel free to share your voice and thoughts with your legislators through this form. And we use something that's called Salsa Labs, and it does connect with people's legislators, but that is what assists them with connecting to the legislators. So we did not ask them to vote one way. We asked them if they would like to speak up for this person who is no longer on this earth because of abuse and neglect, or if they want to feel free to share their voices as a member of the disability community to use that opportunity to reach out. So that is an example. So what this could be is we could have turned this around and made this more of an action alert to create legislation around this particular issue. We could have also said, to had them to voice how appalled they are as well by contacting the Department of Mental Health, contacting legislators. But we did not really put that in their thought process of one way or the other, but we were very careful with wording here. And then again, it's all about the ask, what you're asking, who you're asking, and what you're asking for. That is always going to be lobbying. So remember that. And when you're putting a piece and an idea into somebody's head as well. So when you're saying, a great example of that is, I'm trying to think of a horrible legislation. HR 620 was horrible. I think we're always going to fight against ADA bills that are against the rights of people with disabilities. But if we say, contact your legislator to vote against this bill because it is a violation of people's rights, you can't ask them to contact their legislators. So you can provide factual statements about what a particular bill can do. And you can say, if you want to voice your concerns, here's a way to do so. So this is a little bit more about lobbying and what is allowed. I told you I was going to get to what is allowed with federal funding. Technical and factual presentations on topics directly related to the performance of a grant, contract, or other agreement in response to a documented request. And so this would be if your state legislators are wanting to know, if your state gives funding to IL, if they're wanting to know, the outcomes of the services that you're providing, you can go and present that to your state. You can also present that to the federal government, if need be. Information must be readily obtainable and readily put in deliverable forms. Now remember, you always want to have supporting documentation that you are not lobbying with federal funds. You're always wanting to have documentation if you are lobbying with unrestricted funds. Remember to whatever you are presenting to legislators, whatever you're writing them, that you do keep it and that you file it in an appropriate place. Costs of travel and lodging or meals are allowed when incurred to offer testimony at a regularly scheduled hearing within a written request. And so that's the key word here, is a written request. If you go to a hearing, a Senate hearing or House hearing, and you're offering testimony without a request from a legislator, then that is lobbying. But if a legislator is asking you to come and provide a presentation on the impact a bill will have on the disability community, that would not be lobbying, and therefore you would be able to use your travel costs, your lodging, or meals. Lobbying within limits set by the IRS related to your nonprofit status. And I'm going to share the link with you in a little bit. But you can also, if a nonprofit organization lobbies too much, they can actually lose their 501c3 status. And so there is a calculation that you would want to put in. And it's a relatively high calculation, but you would want to just make sure that you're not using too much. Even if it's unrestricted, I mean, it have to be unrestricted funding, but even if you're using too much unrestricted funding, it could hurt your ability to keep your 501c3 status. And then just careful considerations when lobbying. Check with your state laws regarding lobbying. And then you're going to hear more about this for, I guess, for the part 2, the California perspective. But you'll definitely need to learn about what your responsibilities are for reporting and or registering to be a lobbyist. You may need to register at your state ethics commission and report often about lobbying activities. So in our state, we're required to report how much we spent on lobbying activities a year, and also our activities, and we're supposed to actually do that quarterly. And if we don't do it quarterly, then our lobbyist could lose his license to lobby. You may be required, again, to register as a lobbyist. Document your lobbying activities in your database system, timesheets, mileage, receipts, etc., to show how no federal funding was used to pay for your lobbying activities. And then also educate your staff about lobbying rules. And I think I have a sample policy as well. Next. Plan and prepare to show documentation of lobbying activities. You will need to show that you are using other funding than federal. So again, I think I'll show you a timesheet, but my financial officer in our organization, anytime I need a report about our lobbying activities, she goes into our accounting software and pulls up the lobbying funding stream and is able to show everything that has been documented within our lobbying activities. So if I traveled to the State House, which is pretty close to us, if I travel to our State House, I will document the mileage as lobbying unrestricted. However, I spend my time at the State House is documented as lobbying if I'm lobbying that day. If I'm educating our lawmakers and just stopping in to let them know about the activities that we're engaged in or any concerns within the disability community, then that would be more of education, and I could use Part C funding. But I will make a note of that as well. So I keep the same type of documentation for both Part C and for unrestricted lobbying. We're also required, as a nonprofit organization, you're also required to report on your 990, your lobbying activities. So it's called Form C on your 990s, and this will talk about what exactly you did to lobby and how much money you spent on lobbying activities. So that is another reason why you must keep solid records, because your accountant should be pulling this, your outside CPA should be pulling this to put on that Form C lobbying form. And then lobbying should not be a substantial percentage of an organization's activity, and this is the IRS rule. And so IRS restricts organizations from using a substantial percentage of time, staff, and resources on lobbying. And then there is a website here on the IRS website. There's a page that will actually show you the formula that is used to show if you're using a substantial amount for your lobbying activities or not. And then this is just a very, this is a Excel document that's a sample timesheet that I will show you. And this is exactly how we report our time. So on September 1st, 2019, you will see that I worked 4 hours on Part C, and I was at a staff meeting and providing oversight. But later that day, I went and spent 2 hours with a state representative lobbying when I met with Representative Smith to ask him to support decision-making legislation. And then on 9.1, you'll see that I use Part B for quality assurance, and then it kind of goes to show other funding sources. So really making sure you have clear documentation, and then those funding sources is how your salary is paid. So next. And then remember, staff must know the rules. Everyone on your staff should know the restrictions around lobbying and what lobbying and what the difference between lobbying and advocacy is. And then this is an example for our staff, and it just says, example of Able South Carolina's procedures for staff, lobbying activities. Able South Carolina fully supports the federal restrictions on lobbying using federal funding. Able South Carolina staff are prohibited from lobbying during work hours or in official capacity unless the executive director provides permission. In such rare situations, you will be required to document your activities in seal suites under community activities and document your lobbying time on your timesheet using the lobbying funding source with a brief description of your activities. Below, you will find examples of lobbying activities. I'm saying asking a lawmaker to vote or vote against legislation, getting your members to contact their legislators to support opposition of a bill, endorsing, supporting a candidate, asking for funding for the organization. And then I have a line on here, if you are unsure the difference between lobbying and advocacy, please ask for clarification from your immediate supervisor.
All right, you want me to jump in here on some?
Yeah, that'd be great.
Nice. So tips and tools for advocacy is really, this is, our basic toolbox. When we developed this presentation, one of the things that we wanted to do is make sure that people had a takeaway of what you could put in your toolbox after the presentation and what you could use out there. And so it really starts with building personal relationships. The phone still works. Many of our legislators, regardless of what you may think, are pretty old school. And, the bottom line is they still track the number of calls they get. How interesting is it, walking into a member of Congress's office and you see the staff person sitting there putting little tick marks next to the questions that they're getting for that day. Calls from constituents hold significant value. And because many of our legislators are old school, it's still important sometimes to have those conversations. A legislator that I talked to up here recently shared, he said, I only really ever hear from fewer than 5% of our actual constituents in any form. And so those ones that do call make a difference. And when you think about that and think about how few people that our legislators actually hear from when we're advocating, it's powerful, because that really is pretty much what they deal with every day before they're making their decisions. So one of the things that's really, really important is to develop advocacy programs to help you make systems change in your community. You can do that whether it's forming, at our Independent Living Center right now, we're forming a consumer involvement committee, because consumer involvement is, really the place that it starts. And so developing programs and to help you to, participate in systems change in your community is key. Designated staff who can help empower and educate the next generation of disability rights leaders. When we work with our young people here, that's the next generation. One of the biggest fears that I have, I've shared this with Kimberly and Allie and others, is when somebody tells me that I'm one of the young up and coming people in the independent living movement. And it scares the hell out of me that I'm considered young and up and coming. And then I look at my age and it tells me I'm in my 50s. Because we have a bunch of young advocates out there. We need to empower who's going to be that next generation of advocates. Are they going to be able to understand, to work within these rules of advocacy? So making advocacy and self-advocacy an essential function of your SIL, your ILC. This is going to make you stand out from other disability organizations. You know, we shouldn't be seen as just the provider. We are the disability community serving the disability community. You know, one of the things that has always set us apart as Centers for Independent Living is that we've had an understanding of how to advocate, of how to share what's important to us, and how to do things in a very positive way that promotes systems change and helps us to grow. So it's key that we continue to do that today. And we do that through developing programs, developing others. Doesn't necessarily have to be young people. You know, there's a senior group that, you know, an older group that comes and meets at our center. And you know what? These are some of the most fierce advocates you'd ever want to meet. And, you know, we found a commonality and it's powerful. So tell your personal stories. I know that you've heard me say this a couple times today. And telling your personal story is just so key to all this. And there's so many ways that you can do this. Write your story and have it available. Make sure that you update it from time to time. You know, when you write your story down and you spend the time to do that, it makes it much easier to be able to share that. Ask consumer advocates to write their stories and then ask for permission to share them. You know, we all deal with the barriers to accessible public transportation, or we live in rural communities. Some people don't think there's rural communities where I am, you know, just south of Boston, but my center actually serves folks that live out on Cape Cod and out on the islands of Martha's Vineyard in Nantucket. So we have these geographic barriers called 7 miles or 14 miles of ocean between just being able to get onto the mainland to be able to attend. So if you're one of those folks that lives on the islands, if you've given us permission to share your story, now you're still able to let your legislator know what's important to you. Write letters to explain how the proposed legislation may or may not benefit the disability community. This is really the basics of that writing. You know, what's important to us? How does it benefit us as a community? And then incorporating your personal story and those of consumers, again, with their permission, into that. How is this change going to benefit all constituents? How will this change hurt all constituents? You know, just don't ask them to support or oppose something, because then it becomes lobbying. You're educating on how this affects us. We're constituents, we're persons with disabilities. Now, I'm very careful when I talk about constituents, because some people say, well, that sounds like you're lobbying now. No, you need to make sure and understand that we are all constituents of our legislators. And when we're sharing our story about how it benefits us, make sure that we're sharing it in a way so it talks about how it benefits all constituents of that legislator. So I'm going to jump onto a couple of the slides. I'm going to jump to slide 41. And slide 41, when we get there, is it's tell your story on your 704 report, or as we said someday, the PPR, in separate annual report. These are things that are incredibly important because it's telling your story as the center, and make sure that you do that. And, you know, it's powerful that we're telling our story. And then, you know, a lot of our peers have said, don't hesitate about advocacy because they think it's lobbying. It's not, it's education. You know, legislators aren't experts and they need to be educated. And we are the resource. Nobody knows more about independent living than us. You know, we wanted our piece of the pie, and I love this one. So we formed a public information and education committee so that we could inform the community. And we can do both advocacy and lobbying, but we just cannot use the same funding source for both. So, you know, those are the most powerful things about who we are and what we do. And we were just, you know, really excited to share today. Kimberly, do you want to add anything else before we jump into the Q&A?
It looks like we have a lot of questions, so I think we might want to move into that, and we can probably clarify some things if needed.
Perfect.
Great, thank you guys. And we do have a ton of questions, so I'll try and get through them quickly here. So the most recent one came from Jillian, who says, if your organization has taken an official position on a piece of legislation, is it advocacy or lobbying if you tell your consumers that your organization has taken that position? Where do you draw the line?
So that is lobbying. So you have lobbied for that particular piece of legislation, and you've already set the position that your organization is taking, and you're also putting it out in the community. So that would be Part C funding would not be allowable for that, but you can closely document that. And if you have unrestricted funding, that would be considered lobbying with unrestricted funding.
One place that there's sometimes a little gray area on that is around ballot initiatives. And ballot initiatives are not necessarily a particular piece of legislation. But again, look at the rules in your state on that. In Massachusetts, we can, as a center, take a position on a ballot initiative, but that is not the same in every state. So I know that Allie is going to be, and your team are working on a presentation for the California rules. So make sure that fits there and don't take that as, the written word here.
But on the federal piece, that would not be allowable with federal money. Yeah.
Great. And we have a question here from Thomas. He wants to know if saying negative opinions about a particular candidate is okay, as long as you're not specifically endorsing anyone.
So that's fun. So that would not, there's no language in the regs about that. And so as long as you're not like getting folks behind you, and as long as you're not putting that out in public, I don't think that's considered lobbying. I'm not sure what that would be considered. There's no language in the regs that talk about that particular situation.
Right, and there's none that I'm aware of either. But again, you always have to be very, very careful when you're saying negative things about anyone, and also, think of, when you're putting something out there negative, what does it say in particular about your organization? It's okay to do it anytime on your own, but make sure that you're being very, very careful of the wording that you're using, because you also don't want to have a negative interpretation of who your organization is in the future.
Thank you. Those are some great points. So Benjamin wants to know if a legislative office reaches out to us asking for input on legislation they're contemplating, is that seen as lobbying?
Now that's allowable. So that's advocacy, and that's also written, if that's been requested from the legislator, then that is absolutely allowable. You can use federal funding for that.
Right. You can even actually, if they're going to be having a presentation that they're inviting you to be at, you can be at that presentation and you can educate the community about why that affects you, why that's so important to you. Because at that point, that is definitely not lobbying. It's very, very clearly education.
And we want legislators to do that. We don't want them to sign any piece of legislation that has anything to do with the disability community until they reach out to the disability community and learn how a particular bill will impact us. And so I think that's great when that happens.
Thank you. And we have just a few minutes here left. So we have a question, or more of a clarification from Ron. So he says, once we educate people, they can lobby on their own time. Is that correct?
Yes.
Awesome. And then following up on that, Benjamin says, so we can have consumers sign a petition as advocacy, but then have somebody else make the ask or handoff as in lobbying. Is that correct?
So I'm trying to see, probably need a little bit more information with that question, because it could be seen as both ways, because if you're, even if somebody else makes the ask, you were part of that. So I don't know what they would be signing unless you're gathering gathering facts to make a presentation about a particular issue within the disability community. So I would need a little bit more information with that question.
Right, and the key to that is the ask. Once again, the challenge between advocacy and lobbying is lobbying involves an ask, and so we need to just make sure that we're being clear on that one. You can educate people and educate legislators, educate consumers, and others, and that's totally appropriate. Now, if that consumer or other person now wants to write a letter and say, this is how I want you to vote, and this is how I believe you should vote, that's the consumer that's making that choice. We're not asking the consumer to make the ask. That's them on their own making that choice.
Thank you. And Benjamin, I hope that answered your question. So we have just a minute left here. So I'm going to go ahead and turn it over to Allie for any last thoughts before we close out today.
Thanks so much, Megan. I just want to, if possible, if it's a quick answer, I think if we could, either of you could answer Thomas's question. There's a slide that says info gathering in preparation for an ask counts as lobbying. Is that correct?
Yeah, it depends, yes. So if you're gathering it to go and lobby for a particular legislation, then yes. But if you're gathering it for factual presentation, then no. It depends so if I was to put out a survey and asked a question, I used all the research that was gathered during that time to then use it to steer legislation, then that would be lobbying. So it really depends what is done with it. But if it's going towards lobbying to go ask for particular legislation, then yes, that would be lobbying. And then that time that it took to gather that research too would count as lobbying as well. You're involved in it.
Thank you so much. And I know we're at 12:30. Megan, can you go to the previous slide? So I just want to thank Kimberly and Stephen so much for your time and wisdom, and Megan for your facilitation today, and thank you to our captioner for providing access. And of course to all of you for attending. So next steps that I would ask all of you to do is continue to write down questions or clarifications on what you want to continue to explore around the differences between advocacy and lobbying, because the conversation is not going to end as we end this webinar. Additionally, if you work in an ILC and still have questions, you can always contact, of course, the Disability Organizing Network as your statewide hub and your grant administrator. And then I'd also want to remind you all to stay tuned for part 2, Advocacy and Lobbying, the California Perspective with Alliance for Justice. And then at any point, you can also contact the technical assistance line with the Alliance for Justice, which is an awesome organization that helps to differentiate for folks the difference between advocacy and lobbying. And their number is right on the screen, 866-NP-LOBBY, 866-675-6229, or go through their website, www.boulderadvocacy.org. So again, everyone, thank you for joining us today, and just another big thank you to Kimberly and Steve, and for reminding us that we're connected across the country doing this incredible work of systems change advocacy. Thank you. Have a great day, everyone.